Hello everyone, this is Dr. Chitra here. I'm a gynecologist at SAKRA World Hospital, Bangalore. So the reason I am here with you is to talk a little bit about menstrual disorders. A woman is supposed to have periods somewhere between every 21 to 35 days with about 3 to 7 days of bleeding on an average. So this is something which is unique for every person, and somebody might bleed every 28 days whereas somebody might have a cycle which is like 32 days. Generally periods are pain-free. I wouldn't classify discomfort as pain. You might experience a little bit of cramps and discomfort, which is common for most women. However, it shouldn't be very painful. A period pain is classified as something which needs medical attention when you have to take time off your work or school because you cannot do that and you're not comfortable doing it. So that's the time to see a doctor. The second thing is, what is heavy bleed? So what is heavy bleed is when you are changing pads or your tampons or your menstrual cup every 2 hours or 2 to 3 hours. You need to get up in the middle of the night to change your pad, or you inadvertently stain your clothes, or you're passing huge clots which are like lumps. So this is classified as bleed being heavy, and this very certainly needs medical attention. Then the third thing is, what's irregular period? If somebody has periods once in 21 days for the first month, and the next month they have it once in 35 days, then 32 days, it's all over the place, that's classified as irregular. Or if people have menses too frequently, once in let's say 15 days, or you are forced to wear a pad or a sanitary protection like 15 days in a month, that's not normal. Or you don't have periods for months together, 2 months, 3 months, 6 months. So that is something which is not normal. So the three things we have to remember here are very painful, where you have to take time off work. Is it so heavy that you will need to change every few hours, or you stain yourself if you don't change? Third thing is it all over the place and you cannot predict when you have your next period? So if you have any of these symptoms, it's time to meet a doctor and seek medical help.